Hi, I'm Dr. Beth Molleson.
And I'm Dr. Alyssa Watson.
Thanks for joining us here in the Veterinary Breakroom. Here in the Breakroom, we have short conversations where we just chat informally about relevant topics in veterinary medicine. And today we are here to introduce you to yet another new acronym, that is WASP, or Wait and See Prescriptions. WASP prescriptions, or I guess I should just say WASPs, is a strategy has been started to be used in human medicine in particular, where a provider actually offers a prescription to be used only if a patient's symptoms don't improve or if they get worse in the next few days. So these are things like acute otitis media in kids, some upper respiratory tract infections. You can probably imagine what the goal of this is. It's really to cut down on unnecessary antibiotic use while still sort of giving the patients what they may need, or at least giving them some peace of mind that there is treatment available if needed. And there was actually a really interesting study done recently, which piqued our interest on the topic in pediatric medicine. It was a study on otitis media and the use of WASPs, and they have actually showed that it reduced antibiotic usage by up to 60%. And didn't just reduce that antibiotic usage, but with up to 60%, but also showed that there were no worse outcomes because of the way that these prescriptions were given to the parents. So I thought this is a really interesting topic. I know this is something that probably some of us have done maybe before the acronym even existed in veterinary medicine. So Alyssa, I want to ask you, what's your familiarity with WASPs?
Yeah, certainly I hadn't heard the acronym before. And just like you, I want to call it a WASP prescription, but that's probably kind of like an ATM machine.
Exactly.
machine. I hadn't heard that acronym before. But yeah, I think we'll talk a little later in the episode about, is this something that veterinarians kind of do a little bit more routinely anyway? And now we just have a name for it. I saw the article. It was very interesting, especially as you mentioned that they were having success with this, model or using prescriptions this way, but able to significantly reduce the amount of antibiotics, that were being taken by patients. And I actually had a, personal experience with this where my child had an ear infection. And we went into the pediatrician and we were given a prescription, but told not to fill it yet, not to fill it unless he developed a fever or something like that, which we ended up not needing it. Okay. So that's another thing I think that we'll explore a little bit is, what happens to those prescriptions, how often are they filled later, and where veterinary medicine might differ just a little bit from that, than human medicine. But I'd actually, experienced this personally. What about you, Beth?
Yeah, I think, my initial reaction to these delayed prescriptions was sort of like, it felt a little too similar to that medicine cabinet filled with like old antibiotics from 6 years ago, sort of a situation. It sort of felt like, are we allowed to do this? Is this giving antibiotics out when maybe they're not necessary, which we all know is like a big no-no these days. But certainly I think analyzing it and seeing this study come out and thinking a little more deeper about it, I think it makes a ton of sense. As we all know, antimicrobial resistance is a huge concern. And not only can antibiotics have certainly more public health resistance issues, but they tend to not be good for the individual patient. It messes with your microbiome. It's not a benign treatment as so many of us have a slight tendency to think of them as, or certainly as I feel like pet owners maybe more commonly think of. So I do sort of now love the idea that it's permissible, so to speak, to maybe not start an antibiotic right away if you don't think it's necessary. I also love it in the sense of, I can't, I don't know if you guys are like me, but I feel like at least, this is obviously an exaggeration, but this is how it feels. Like half of your pets that come in are leaving on vacation the next day. It's like there's always a pet health emergency as somebody's leaving town or the pet sitter's coming. So I really love the idea of it for this, where it's like, hey, I don't want you to be stuck in the middle of nowhere with your pet not getting better, but at the same time, my gut is telling me that this is going to resolve on its own in the next few days. I think that sort of taps into a big part of this, is making sure you have a good relationship with the client that you're dealing with, making sure you have that communication, that understanding, and you feel like the WASPs is going to be used as you intend it to be.
Right. Yeah, I agree. I certainly think that this approach will reduce the number of like follow-ups or emergency visits. People coming in, it's kind of same thing. They come in on a Thursday or a Friday, especially, acute diarrhea, and we want to try probiotics or something first. But also, I don't want them to get into a situation where then it's Saturday or Sunday and my clinic's closed, and now they're incurring additional expense to go into the emergency or to an urgent care, and they're putting additional stress on those clinics where other patients could be seen. And so having that plan in place and having something to do to avoid that, I think is really, really valuable. But just like you said, it also comes with the caveat that we need to be very, very clear about, compliance, give the owner instructions, very detailed, probably written instructions about when to fill it, how to fill it, why to fill it. And I think that from the standpoint of, looking at the differences between human medicine and veterinary medicine, I think we do have a little bit more of a risk of misuse, only because of things like species differences. You really have to be careful. A lot of times people assume that if you've prescribed something for a dog, it's safe to give to their cat, or something like that. And so there are all those nuances that come in that we need to be proactively thinking about as we adapt this model.
Yeah. Yeah. I think there's also, to me, one of the other biggest risks here is, in an ideal world, we would see our patients. And then if we felt like we weren't sure if they were getting better or worse, we'd check them every day and see how they're doing, see how they're trending. We'd intervene with our therapeutics at exactly the time we wanted to, but that's just not reality. Like you said, Alyssa, so many times we see these pets once. A follow-up is a huge hurdle, financial, stress-wise, all of that good stuff, scheduling wise. So that's not always possible. But in the same vein, one of my biggest concerns is a pet going to maybe be getting worse? And then a few days later, the owner's trying intervention. Whereas to me, if the pet's getting potentially worse, that's when I do feel like I need to see that back. So that's kind of my concern, is saying, hey, if your pet gets worse, give it this. Whereas to me, that means, hey, if your pet's, whatever the case might be, is a little bit worse, give it this. Whereas say the pet stops eating, is lethargic, and can barely move, they see that as getting worse and start giving medications, when in reality, if I saw that pet's condition, I would change treatment plans altogether. I feel like that risk is a little bit higher in veterinary medicine too, when our patients can't talk, when there's such a big financial hurdle associated with rechecks. So that's another thing for me to keep in mind.
Yeah, I agree. And then, just the other challenges, tracking challenges, I think it was cool to see this article, from the human side, where they said that, they didn't have any worse outcomes and 60% of these prescriptions weren't filled. I don't know how we would even, go about monitoring that in veterinary medicine to see, are we actually improving stewardship? How are we supposed to know if there's no way to track, which of these prescriptions get filled and which don't? So just another thing to think about.
Every cat's visit to your clinic is an opportunity to spot the subtle signs of osteoarthritis pain. When you diagnose OA pain, be confident in recommending Silencia, Frunevetmab injection. Monthly Silencia controls the pain of OA in cats, helping to improve their mobility, comfort, and well-being. Turn one-time visits into lasting partnerships. Visit silenciavetteam.com to learn more. For use in cats only. Women who are pregnant, trying to conceive, or breastfeeding should take extreme care to avoid self-injection. Hypersensitivity reactions, including anaphylaxis, could potentially occur with self-injection. Silencia should not be used in breeding, pregnant, or lactating cats. See full prescribing information at silenciapi.com.
The other thing that, obviously this was specifically about antibiotics. You can see how this approach, directly when we talk about antibiotic stewardship and things like this, you can see how this approach just directly applies very, very well to antibiotics. But I do think that there are potentially other cases where you can use this wait and see approach. And the big one that I do, and I've done this, this isn't theoretical, like I have done this, is when I have an animal come in that I am worried is kind of on the cusp of heart failure, and I take my x-rays, and I'm waiting for a radiology report. I can see a big heart and I'm like, well, is there a little edema there? And I want the owner to go home and track, sleeping respiratory rate for a day or two to really decide what I want to do. Again, just like you said, it always seems like that case is like Friday at 4:00, or, or I'm not going to be back, or the owner's going on vacation or something like that. And I don't want to risk this animal going into failure, when, and potentially have any emergency situation. And so in that situation, I think sending home like a couple days or a few doses of furosemide with the clear instructions, like you need to track the respiratory rate and do these things. And then you have this, if that happens. So just another place where I think these prescriptions could potentially be useful.
Sure. Yeah. For myself, as Alyssa knows, tore my hamstring water skiing recently. And I was right before I was supposed to go on a trip, and I saw my orthopedist, and she said, hey, maybe this will feel better in 72 hours. Maybe it won't. Why don't I call you in a steroid? And that way, if you're really struggling on your trip, you can use it. If not, you don't need to. I thought that was a really good case use of that. Of course, those sorts of things become a little bit more challenging to assess in our patient in terms of uses for pain control and things like that. But I thought that was neat. But yeah, I'm left in the same position that we worry some of our pet owners being in, where it's like, hey, I did fill the medication because, again, I was going out of town. So now I have this medication that I didn't use at the time it was prescribed. When am I going to get a wild hair and start using it? I think that's something to keep in mind. Like we already sort of talked about with antibiotics, but it's like, oh, is the next time, sure, these parents didn't use those antibiotics from the study during the otitis media, but next time their kid has a sore throat, are they going to just have the kid start popping them? I think some of those things are hard to predict, and certainly definite downfalls of these WASPs.
Yeah, I will admit I am a hoarder of ondansetron. Anytime I get an ondansetron prescription for anybody in the family, I'm like, that goes in Alyssa, the cabinet, and we pull that out for emergencies, because I hate
that was
throwing up.
On my list, and it said exactly the same thing. It said, I think everyone should have a WASP for ondansetron, because by the time you feel nauseous, you're not able to get to the doctor. There's no helping you. You need that prescription already.
Well, I think that kind of probably brings us to the close of this conversation. It's certainly something cool to talk about. Check out the study, you guys, if you haven't seen it. It's very interesting. And, like we said, maybe you're already doing this and now you just have a cool new name for it. Did you want to share maybe a win of the week, Beth?
Sure. I have a pretty big win of the week. Just in regards to Paul, my dachshund and the love of my life. He was having some very nonspecific signs of illness a few weeks ago. Of course, right around the time that I was leaving for town. I'm one of those pet owners right around the time of my hamstring rupture. There was a lot going on. And Paul, all of a sudden, just was sort of ADR. It started with his eyes were squinty, and I thought maybe he had a primary ocular issue. But then I noticed he wasn't, normally he loves to like try to kiss me. He was barely sticking his tongue out to kiss me. He free feeds, don't judge me. But I couldn't really say if he was eating well, but I could tell he's only 12 pounds. When he loses weight, you can see it almost instantly. I could tell that maybe he'd lost a little bit of weight. But his exam was normal. His blood work was normal. His chest x-rays were normal. Like everything on his exam was normal, but he wasn't getting better. So throughout this week, he saw essentially me and my colleagues at our primary care office. I had my neurologist friend give him an exam in case he had back pain. The lovely dentist in the area rushed him in to see if she thought maybe he could have like a, abscess or something going on in his mouth. She didn't find anything. And right when I was ready to do, and so then I left for vacation. I was hoping for the best, hoping he'd be fine when I got home. And sure enough, he miraculously was 110% normal when I got home, more active than I feel like I've seen him in forever. So I still have no idea what it was. My suspicion is maybe just some sort of unidentifiable pain that has since resolved. But, in a 12-year-old dachshund that's ADR and losing weight, I thought he was a goner because that's how my brain works. But he's great. Back to normal.
Oh, I'm so glad to hear it, sweet Paul. Yes, we got many texts of his squinting eye. We were all
I know. Yeah, I was like, does he have uveitis? No uveitis. Yeah. Oh yeah, the eye. He got consulted by an ophthalmologist, of course, because only the finest. So
yeah.
But what about you, Alyssa? Any big wins this week?
Yeah, I actually do have a big win. I mean, it's a forward-looking win, so this will not be for a long time. But I booked a bucket list trip, like one of those trips that I've wanted to take, my whole life. So, but it won't be till 2027. But it's okay because I need to spend that time saving up the money for it. But my husband and I are currently booked on a Nat Geo cruise, like one of the little ships that only holds 96 passengers, to the Galapagos for a week in 2027. So I am so excited. This is something that I've always wanted to do. It's going to be a week full of just, the most incredible nature and animals, and there'll be naturalists on the ship, going out on the excursions with us, and we'll get to snorkel with marine iguanas and all of these species that really are only found in this one area of the world. And I can't tell you how excited I am.
I can't tell you how jealous I am. That sounds fantastic. Are the kids going or are they staying behind?
They are not. We are leaving the kids. Don't feel too bad for them. They have a Disney cruise a few months before that. So okay, you don't need to feel too bad for them.
Not too neglected.
No, this is one that has been on our list for my husband and myself that we're going without the kids. But yeah.
Good. Well, lots to look forward to our audience. Thank you so much for listening in today, and we will catch you next episode.
Thank you for joining us in the Veterinary Breakroom. If you enjoyed today's episode, you can find us wherever you listen to your favorite podcasts, including a video version on YouTube. While you're there, make sure you subscribe, rate, and review. You can also listen to or watch our podcast episodes on our website at cliniciansbrief.com/podcasts. Or drop us a line at podcasts@instinct.vet. Veterinary Breakroom is an Instinct Science production, produced by Alexis Ussery and co-hosted by Alyssa Watson, Beth Molleson, and Katie Berlin.